I'm the director of the stem cell and bone marrow transplant program at Augusta University, and I'm also the associate professor in medicine. So I've been here actually in Augusta for almost 17 years, I should say. I did my residency here, I did my fellowship here in Augusta University. I was on faculty here before leaving to Emory in Atlanta, and then came back 3 years back to handle the role of the directorship of transplant program here. But more importantly, to bring the CAR-T program to here to Augusta University and the Georgia Cancer Center. CAR-T is a newer approach to how we treat cancers. It's already FDA approved in 3 indications, myeloma, lymphoma, and leukemias, certain leukemias. So it's a very, very new approach on how to use immune system to modify our responses, our treatments towards cancer. People have always wanted to use immunotherapy to fight cancers better, because chemotherapy has its advantages but has its huge disadvantages in terms of people tolerating the high-dose chemo and the side effects of the chemo, both short and long term. But if we can take out the immune cells from the patient which are not handling the cancer properly, teach them how to target the cancer better and give it back to the patient, they do go and do their job, which is what they're taught, go and fight the cancer. And that's essentially, in simple terms, what CAR-T is. We take out these immune cells called the T cells from the patient, modify them in the lab at a company lab, and then bring them back and just give the cells back to them. They go in and attack the cancer cells because that's the only thing they can recognize and kill the cancer. And certainly looks like it's going to be the future of cancer therapy, and will be in multiple tumors, not just in leukemias and lymphomas that we see now. And it takes a village to do a lot of it in transplant, and not just with bone marrow transplant. Even solid organ transplant needs a lot of team members to work together, because I think this is an award for the entire team, not just for me. But it's humbling even more because it's coming from Red Cross, which is an organization that helps multiple countries. It's not just one. And among the many things they do, I think the blood donation and making, we see the other end of patients receiving the blood and benefiting from that. So I think receiving this award is obviously a very great honor. This probably will be the biggest award, more so because it comes from one of my favorite organizations called Red Cross. So I think I take it with a great sense of honor and humility to receive it.